Uh, Very good afternoon to everyone. This is Dr. Hemanth. I'm the faculty for medical oncology at DocTutorials. And with me today is Dr. Prasun Bhaskar. He has secured rank 3 in INISS April 24 and rank 3 in AIMS Merit Plus. And he will be joining AIMS New Delhi soon. Hi, Prasun. Good
Yes, sir.
afternoon.
Good afternoon, sir.
Hi. How do you feel?
Relieved, sir. I think
Relieved. So frankly, people keep this word in mind. The word is relieved. Okay, I feel really fantastic about this, but even I feel relieved. Okay, and we are going to discuss on why the word relieved rather than anything else. Okay, so Prasun, just tell me, where did you do your undergraduate and then postgraduate, and your experience in oncology?
yes, sir. So I've done my undergraduation from JIPMA, Pondicherry, and then I did my post-graduation in medicine, MD medicine from SMS Jaipur. Following that, I'd worked in Safdarjung in medical oncology for a while as SR for a few months, and then I was had to medicine SRship for a while. Then I joined as non-acad SR here at AIMS, Delhi, and that's it now.
That is how it. So, so he has got medical oncology experience, medicine experience as SR as well. So, uh, so why medical oncology? Why probably not any other field?
So actually, to be very honest, at the beginning when I had probably started MD medicine, medical oncology would have been at the bottom of my list to take super specialize in. But then in my MD itself, I had we had my unit head that I had worked under was Hemant Malhotra. So he was in medical oncology,
Yes.
and then that was for a while, and that's when it was in the back of my mind that that medical oncology was into the picture for me, that I might think of doing it. But then I was not sure about it. I was not sure about it for a very long time. I did not. Basically, when I finished my MD, I was not sure about what I want to specialize in, but I was sure that I want to do DM in something. So I did like medical oncology by then, and then I thought, let me just work for a while and then see what I really want. So for I think until a year after MD, that is how much time. That is when I was actually sure. Okay, I really want this, so I'll start preparing for this. So.
Super. Frankly, Hemant Malhotra sir is an inspiration to all of us. He is my namesake, so I am very fond of him. Otherwise, also, and I was very lucky to receive my TISA award, Torrent Young Scholar
Okay.
Award from him. Okay, so it was in Jaipur. The finals were, and I received my award from him. So I was very blessed and fortunate to have got it from him. Hemant Malhotra sir is a fantastic person. The his experience in CML. CML is something that he's really fond of, and his experience CML is vast. Okay, he's in the ICMLF Foundation. He's been the president of ISMPO, and very fortunate that we sometimes some people do get kind of such experience. So frankly, during my MD medicine, I did not have much exposure to medical oncology, but I was fortunate enough that I had exposure to medical oncology during my MBBS days. So that's where I got really excited in seeing lymphomas, myelomas, etc, and that is where I feel that one needs some exposure at least to oncology during their MD time to know really. It is not just see a case by probably working even for a month's time lets you know that what this field is really about. Okay, because most of the student as students, even probably I had that oncology is it's only about terminal care, nothing much, nothing exciting, probably everyone's going to die anyway. So what about it? But you start seeing that things are not so on a practical ground basis. Things are not so, things are much better. There are people who are cured of cancers, breast, lymphomas, uh, colon malignancies, they are cured of cancers. You have even kind of very advanced disease doing very well. At the same time, you have advanced malignancy where you offer good palliative care, which is also extremely important in the field of medicine as such. Right? You agree with me?
Yes, so practically, we used to think that it's a very depressing branch and such, but to
Yeah.
be honest, I think onco is one of the only few branches where people are actually cured of the disease. Like a patient can be cured of breast cancer, but a patient cannot be cured of CAD or
Yeah.
probably.
Yeah, this my mentor told me that he asked me uh, in which field there is maximum cure. The first is infectious diseases, second is oncology. Okay, no other super specialty field has so many cures. So technically, we are absolutely true. So very good. So now, how much experience of medical oncology, or say post your MD medicine, how much time did you spend in medical
Uh,
oncology?
yeah, so initially I had worked for 4 to 5 months in Safdarjung Hospital, and then here I joined in September end of last year as non-ac SR. And here I think it's been 7 8 months already.
Nearly
I think
8 months.
October,
Fantastic.
early September end.
Okay, fine. So we discussed about the word relief. Now we are going to kind of really discuss why that word. Okay. So Prasun, where did me, Vijay, and DocTutorials come into play? Okay. And how did you come to know about DocTutorials? And where did you start your journey with that? When did you start?
So basically, last year during the July exam, I was not very aware of the sources by then. The like sources in the sense the video sources as such. Uh, the particular sources where I could go ahead and find something to prepare for the exam. So I had been making my own notes until then. And during, like, I had taken a question bank from DocTutorials late towards the exam time. This was last year when I started preparing for this also for medical onco properly. And before the interviews, I had given a mock interview with you, sir. So that is actually the point where I first interacted with you and Vijay sir.
Yes.
And that mock interview actually was, although right now this that was after the theory exam. So the mock interview had in itself was kind of a revision of brief revision of the entire oncology for me at that point. Although in the interviews right now they don't take more than 2 3 minutes of interview. They ask
Yes.
4 5 questions, but the point is about going into the interview with some confidence that okay, I have an idea of what could be asked. So that at that time for me it was that is where it started, and then I took up the entire. I started watching your videos, and
Right.
this went on till this exam.
So what content probably you think really helped you, and which probably is something that everyone else should focus on?
Yes, sir. So basically, I feel due for entrance exams, like reading from books is always a good thing. I'm not too this thing to say about it, but this
No.
is my personal experience that I feel reading books is fine. The core fundamentals and basics and knowledge, whatever we get from reading books, is one thing. But for entrance, uh, it's a lot of for me. Entrance exam is a different ballgame altogether. Like it's more about just clearing the exam initially. So obviously clearing an exam like INISS, it's not more about memorizing facts and everything. It's a lot about practical knowledge, one thing, and another thing to know what is important in the subject. So while reading medical oncology from a textbook without actually having worked also and having even if we have worked for a while, reading from a textbook without having a good experience is very difficult to start with.
Yes. Yeah.
So, and also I prefer generally for entrance exam, it's always, I feel it's better to go through videos because I feel the person who is teaching you and sir who are teaching us, you probably had a lot. You know what is important in onco and what aspects of oncology has to be taught. So overall, to know about the uh, subject, it helped me a lot in
Right.
general also.
Yeah. So absolutely true, like how you said. I still remember the first book that I read when I was preparing for oncology was Cassiato. Okay. So Cassiato handbook was what I read, and somebody told me that is the most easiest one that you can read. And then you have the Bethesda handbook also. Okay. I did not open Devita at all. Okay. These two handbook, but frankly, I just could not make head or tail of what is written in that. Why a particular chemo regimen is called FEC, FAC, okay, ABVD, RCHOP. I just could not understand what these guys are really talking about, and some crazy stuff on how the regimens are given on day 1, 8, 15, 22. Okay, something is given on day 1 and day 10, nothing after that. Okay, so one doesn't really understand these things by actually reading the books. Okay, even the fundamentals per se, it is really good to read it from the books, but sometimes it becomes extremely difficult to understand, because medical oncology, as such, the exposure during even our MBBS MD is not much. My favorite topic, I still remember, was Robin's pathology tumor. Okay, I enjoyed reading that chapter. So that basic was there, but from there, from the pathology perspective, going into other molecular or even kind of clinical perspective, that gap was missing. So I was finding it difficult. Luckily, I ended up working as 6 months post MD SR in medical oncology in Mangalore only. Okay, and that is when I started realizing that why certain things are done in a particular way and why not. Okay, so it became more simplified. And when we started this journey with Dr. Tus, me and Vijay, we are both colleagues. He was 1 year junior to me at Adia. So we wanted to know from the students only. Initially, we learned from the students only as what probably is really important to be focused on, what is something that is asked in the INS SS. It keeps changing, but at least kind of we got an idea of what goes into the exam and how probably the interviews are done. So it is from our students only we learn, and that is when we try to modify whatever we have and try to bring things. So I think QRP sessions is something that we try to work on more, because it was a really compact lot of content, but really focus that these are probably tuck things that one needs to go through before you really prepare for the last few days. Agree with that?
Yes, definitely. So QRP was one of those things that I actually went through. I went through in the sense I started the video. I watched QRP right before, like 3 4 days before the exam. It in total, I think it was 4.5 hours around that, if
Yes.
I'm not wrong. So I would just watch it in 2x because by then I had gone through whatever I had to study basically for
Right.
the exam, and I can't think of revising entire onco. I have a few one like I would write some concise notes of 1 page and this thing. So in addition to that, I just would go through these videos at 2x. If I have to go twice, I would go through it twice.
Yeah.
Just before the exam in the last week, I did that actually before the exam. So I went to
Yeah,
the
same way like how you told. I had like my own QRP notes in 2000, back in 2015-16, of nearly 4 5 books which I had to kind of rush through. But frankly, this working going in 2x speed, revising again and again the same thing that you have kind of seen, makes it really impactful, that you really absorb the thing, and it's very easy to kind of comprehend that come out in the exam. So the AIMS INISS theory. So you have medicine and medical oncology. How do you prepare differently for each of this?
So, sir, thing is, okay, this probably is my opinion on this has changed a bit from what it used to be earlier. I felt because during the time I've been working here, uh, I have probably not had enough time to study medicine as such. I would go through a few things, and I'm not sure what I would feel was important for the exam, and I probably spend more time on onco only to prepare onco, and I also feel retrospectively that medicine in AIMS. Earlier, I used to feel that medicine is probably a deciding factor, but it is not really necessarily so. It doesn't really. It's
Yes.
not necessarily the deciding factor. So the thing is, for medicine, we do need because the questions that are asked in AIMS, they are not very factual textbook rote memory questions. They are
Yes.
more based on because as long as you're a pass out, like your MD medicine, it might be difficult for other specialties. Like for pediatrics, it might be difficult
Yes.
to
Yes.
start off anywhere. But for people who have passed out from medicine, it's not going to be very different for different people because the questions that they ask here are more practical. Whatever I see, it sometimes feels like maybe they've come across a case like this in their ward and then they've put a question on that. So it's more on that, on more on the working uh,
Yes.
knowledge is what they test in medicine also. So I think specially preparing for medicine separately would not be a great strategy. Although we have to go, it's not we can't ignore medicine
Yes.
for sure. We'll
Yes.
have to go through whatever we can go through,
Right.
whatever we feel is
Right.
important. There are a few important topics. Definitely, I feel that one is infectious diseases, critical care medicine. then certain tables of Harrison gastrology. So those
Yes,
are places where where questions are definitely asked from. But
definitely.
again,
Yes.
yeah, it may not be directly from what we have read, but
Yeah,
it may be
absolutely.
around that, and we may be more confident to take a guess between two options. Usually, confusion between two options in aims always.
Right. So in preparation point of view, probably one, somebody, in case you have two things to crack, okay, cracking one is probably more easier. Try to focus more on that, right? So
Yes.
probably working in medical oncology itself is going to be an added bonus, because we know that over the last 3 4 years, at least last three sessions, okay, so
Hmm.
last three sessions things have been more practical, okay,
Yes.
things have been a certain drug, how often, kind of what is the duration, like say methotrexate in
Hmm.
imaco, what duration you give. So this, in case you have worked, you will know. Okay,
Yes.
oxaliplatin, in what solution you give, you have worked, you will know. Okay, you don't need to really think about.
Hmm.
So it has been more kind of practical based, and probably definitely having some work experience in oncology makes things extremely easy.
Yes.
Yes, there are certain questions which are going to be difficult, which are going to be unpredictable, right? So, but otherwise, work in medical oncology and trying to focus on one part is going to be easy. But at the same time, there are people who are preparing for NEET tests. Now that becomes a different ball game together. So I feel, in case somebody is really dedicated, should go for INISS, and I feel INISS is an easier theory exam to crack. I know it's lesser number of seats. I know it is a very tough thing to write the exam again and again, and feel that am I really going to be there the next time? Okay, but then I feel, as a theory and the practical part, it is an easier exam to crack than NEET. NEET has got more options, more seats, but in case somebody really wants to kind of get into the system, this would be the best way. And probably, in case, see, most of the NEET places have bond, right? So say it is TMH, any place, you're going to have a bond of 1 year post DM. Why not dedicate that one
Definitely.
year prior to that, so that you don't have any bond later on, and you do from the one of the best places to do medical oncology from. So that is where I think Prasun had really hit the point. Prasun, this is which attempt of yours trying to get into the system?
So once I started preparing, I think l- twice I've given the interview, November and last
This is the third
June.
interview, right? This is the third
This
interview.
is my third interview, sir.
No, this is your
This is
third
the third
interview.
interview,
Yes.
sir. But like the first time I had given, I had not prepared much, so I was not hoping anything.
Yes,
That was
yes.
in,
No, but I'm just telling
but
people to
last
know
year,
that.
no. So the thing is, 2022 November I had given the interview, and to July I had given the interview where I, yeah, so missed
Yes,
it by a bit, and last November I had not cleared,
yes,
and
yes.
then this was my
And that
third
is when
interview.
I asked you, what are you going to do,
Yes,
right? Okay.
and
I've known Prasun from 1 year now. I was just going through our messages again, that it's been nearly May 23 that I'm known. He had cleared the interview in May. Unfortunately, for the interview session in the November, he had not cleared. But see, that is the dedication that one needs to stick to. See, this is the place I want to be. This is the place I know I can be. It is just that probably it was not your day that time. Okay. So sticking back, staying in that place, working as non-acad SR, the work is really hectic. The work is hard. It is not an easy work being a non-acad SR in AIMS Medical Oncology. But then being consistent, being perfectionist at the point that you are going to keep repeating the same effort that you have done, knowing that probably there's a good day that is going to come, right? And that good day is now. So he did not fall back, he did not fail that, probably whatever that 12th fail exam, repeat, repeat, repeat. Yes, probably it is worth it at the end of the day. So that is that place. I am actually very relieved, as Prasun said, and extremely happy that he cleared. So Prasun, so you were a part of our mock interview session in the
yeah.
past. How do you think the mock interviews were compared to the actual interviews, and how, where it helped?
So, sir, basically, what happens after the theory exam results? It's I think it's the case with most people, the people who I have met or known also. That once the theory results are out, it's very difficult to get back to reading for an interview where we, in our heads, we know they can ask us anything they want,
Anything?
and it will be a short interview, and they'll ask anything they want. So it is very difficult to go through everything. again before the exam. Although we would go through some
Yes.
important topics, maybe emergencies, important cancers, and all those. So at that point, having a mock interview session for 2.5 hours, 2.5 hours, it may or may not. The point is that it may or maybe the entire 2.5 hours of what we have listened to. Maybe if you're asking me questions on AML and they ask me on AML, then that's the
Yes.
thing that will help me a lot. There's no doubt.
Right.
And you might ask me questions. I might go through questions like I might hear questions throughout the interview, which will none of which would be asked in the interview. In spite
Yes.
of that, it's more about get in the interview is not about knowledge here. Not
Right.
I wouldn't say that you can keep quiet and be okay with it,
Yes.
but the confidence to get into the while getting into the interview is very important,
Yeah.
because we might go blank with things which we know also there. So, because they'll just ask us 4 5 questions. That's it. It will not be longer than 4 5 minutes. Five
Yeah.
minutes interviews and 5 questions maybe. And it will be around that. So we should at least be
Yeah.
confident that if we know the answer, we have to answer.
Right.
So for that,
And
this
usually,
mock interview for me, I think is the only preparation that's there before the interview.
yes,
So,
yes. So the questions are going to be extremely basic. Okay, some emergencies are going to be there. Okay, some basic malignancies are going to be there. It can be we will definitely not know what they're going to ask, but at least kind of get an idea that how things are going to be. It is going to be very crisp and short. Our mock interviews were long, so they're trying to explain and teach what could one probably want the answer as. Okay, but it is going to be extremely crisp and short. It is going to be about very basics, and more so it is to have a presence of mind there, that when they ask something, keep calm, think, and then answer. Okay, so that is extremely important, I feel. So Prasun, we are really happy that this time you're there, and it is consistent effort. It has been your effort, and we are really happy that we were part of this journey. And you have kind of cleared aims now, so congratulations on getting rank 3 and going into the best system that probably I think is currently there. Okay, and we wish you good luck, and we definitely are going to meet each other soon sometime. So, last few words from your side on to students, how one should kind of really prepare for the INISS, coming INISS.
okay.
What things you think are really important?
Yes, sir. So, for people who are just going to pass out and give the exam, fine. But the first thing I would want to say that for anyone who has passed out already and is trying to get into AIMS and is preparing for NISS, medical oncology, I would say it's always better to have an experience in medical oncology. It is going to help. Instead of joining anywhere else, it's always better to join medical oncology, if possible in AIMS Delhi, if not anywhere else, wherever it is, because theory exam is the key. So interview is not going to make that much of a difference to the results. It
Yes.
usually doesn't. It doesn't make a lot of difference. If your theory is good, then interview won't matter at all, actually. So for that, the kind of questions that are asked, they have a major chunk which is more on the practical aspects, the recent advances, and things that there are a lot of it. There are a few questions, maybe 5 6 questions will be such that you will be able to answer only if you have worked in oncology. And 5 6 questions are enough for 4 or 5 seats to just take us out of that. So I think that is the first thing. Second thing, when it comes to reading, I feel it's not important to go through. No one needs to read the entire textbook of
Right.
David or anything. The point is, okay, there are a few. The first few pages, I would say, the first 200 to 300 pages of the new Davita. That is definitely important. That has to be gone through because they
Yes.
repeatedly ask questions from there, and that is one thing. And for the rest of it, it's more important to know what is important. Maybe that's what I had gone through all the videos as such, and then focus. That is the first thing that has to be done. You need to have a source to go through to know what is to be read to understand medical oncology first, and then following that we have to focus on topics that are asked more commonly in names. So
Yes.
that needs to be that has to be done next. So the first thing we have to have our basics clear. That if it's CA colon, we need to know everything about CA colon, and then focus on topics which are repeatedly asked in AIMS. Okay, they ask more on what are high risk features and support whatever. If it is
Right.
CA colon, so we need to know what is more important and revise that again and again. and make it's always better to make notes of such things which are important. Make a list of topics which are more often asked in names. So this is what is more important, and to also go through medicine a bit, to not leave medicine for sure, but not spend a lot of time on medicine. I would say maybe if we are reading 6 hours in a day, then 4 hours of onco and 2 hours of medicine would be my division for that.
Yes. Yeah, okay. And fourth and most important thing is, don't give up hope. There's always
Definitely.
hope. You keep working hard, this is what I want, you will get into that place. Okay.
Yes.
And that is what I've learned from Prasun, at least. Okay. That you need to be consistent. You need to tell that, okay, this time it's not done, the next time is there, and I'm going to be there. Okay. Congratulations, Prasun, for this, and we are really
Yes.
happy that you're going to AIMS. And thank you very much. And I really feel very happy to be part of this. That I know that when you're there, our chats are there. That when
Yes.
you're there, that things probably not going fine, but okay, fine, let's do it once more. It Very happy to be part
I
of
had a
this.
after the July results last year about whether I should join or not join. Almost a 1 hour conversation at night. You had called.
Yes.
That was very generous of you to call and talk about it actually, because I was very confused. I was a little upset about the way I was out, and so I took some time to get over it. But yeah, so that was it.
Yes,
Thank you for
yes.
that.
No, no. It has been your dedication and hard work. We were a small part of it, but we are very happy that we got that opportunity to be there. And definitely welcome to medical oncology. It's a fantastic field. Work hard. Okay, it is a difficult field. Work hard. Be passionate and have that compassion to your patients. Care for them well and be a good human at the end of it. Okay, that's all from me. And thank you, Dr. Tutorials, for having this small chat with Dr. Prasun. And thank you all.
Thank you.